Hello everyone, my name is Zarif Akbarian. I work with MOSAIC as coordinator for health promotion. Also, I have Betel Luli with me today, and we are going to talk about MOSAIC Tuberculosis Literacy Project. We have a presentation for you named Training the Trainers, and this presentation is intended for service providers, community and cultural organization frontline staff who are serving diverse ethno-cultural communities. I will give you a little bit background information to understand why it's important that we all need to work together to raise awareness and reduce stigma about tuberculosis. Tuberculosis, also known as TB, is a serious infectious disease caused by Mycobacterium tuberculosis and is spread through the air. Tuberculosis has two forms, inactive or latent TB, which stands for the majority of cases, that is about 90 to 95% of cases, and active TB or TB disease, which stands for 5 to 10% of cases. According to the World Health Organization, tuberculosis is one of the top causes of death, one of the top 10 causes of death, and the leading cause from a single infectious agent worldwide. In 2018, an estimated of 10 million people fell ill with tuberculosis worldwide. There were cases in all countries and age groups. TB is curable and preventable. About 1/4 of the world's population has latent TB, which means people have been infected with TB bacteria, but are not yet ill with the disease and cannot transmit the disease. People infected with TB bacteria have a 5 to 15% lifetime risk of falling ill with TB, and persons with compromised immune system, such as people living with HIV, malnourished, or diabetes, or people who use tobacco, have a higher risk of falling ill. Canada is amongst the countries with lowest TB per 1,100 population, but still there are cases occurring each year, and it's remained constant for past decades. According to Public Health Agency of Canada and BC Centre for Disease Control, about 80% of all tuberculosis new cases occurring among foreign-born Canadians, and this is largely due to reactivation of latent TB infection from exposure to TB earlier in their lives and not from local transmission. While TB is rare in Canada, some communities are at a greater risk of TB, including foreign-born Canadians from high TB burden countries of origin. And to combat TB in diverse ethnocultural population, it is particularly important to address both lack of awareness and health literacy in regard of TB, as well as TB-related stigma. This project was from 2019, started from June 2019 and ended March 2020. During this time, MOSAIC staff work with healthcare providers, service organizations, and diverse communities to raise TB awareness and reduce stigma, as well as addressing other social determinants of health and facilitate more equitable access to TB services. This project was funded by Public Health Agency of Canada, and our approach was multi-sectoral, community-guided, and community participatory. During this project, MOSAIC staff consulted with a number of fellow community members, service providers, community and cultural organizations to make sure that all cultural sensitivities and all the language sensitivities are considered in designing and holding community focus groups. So I'm going to talk a little bit about how we conducted the focus group. So MOSAIC staff, they prepared a questionnaire and they reach out to several community organizations, service providers, community leaders, and to bring this conversation that in their community, how people view TB and what are some of the cultural beliefs and considerations and sensitivities to be considered. And based on those consultations, then the focus groups questionnaire as well as the contents and the way that we should approach the community members, they were designed and we collected all the information. So based on those consultation, focus groups designed and conducted. The purpose of the focus groups were to gather information from Metro Vancouver residents, from diverse ethnocultural communities on their understanding about TB, as well as to find out about the barriers, challenges, and gaps in accessing TB-related services. Altogether, 5 focus groups conducted, and in each focus group, around 8 to 10 participants from each community participated. So a structured questionnaire used, as well as the notes and the open discussions were recorded. Each focus group was facilitated by a MOSAIC staff and a community volunteer as a co-facilitator who helped with facilitation, with coordination and inviting the community members, as well as with interpretation. So 5 focus groups were conducted for communities, namely Afghan communities, Chinese communities, Sudanese communities, Tigrinya communities, and Vietnamese communities. And there were 49 participants, almost equal representations from male and female, and all adult age categories, 25 male and 24 female. So what was the outcome of the focus groups? Information that collected through the focus group, they were compiled and they were translated from the community language into English. So, and then the data was analyzed, and based on the data, TB pamphlets and this presentation were developed. Now, I ask Betel, my colleague, who will talk about some of the highlights of the focus group consultations.
Okay, so there were some key points that highlight the level of community knowledge on TB, particularly TB. As Zarif said, there are 49 participants that were involved in the focus group discussions. 69% are permanent residents and 31% are Canadian citizens. A high number of participants, 80%, had some knowledge of TB and were able to describe signs or symptoms, transmissibility, and treatment of TB disease. However, only 35% of the participants had some knowledge about latent TB. And the rest, about 65, answered that they did not know or they did not provide any information about latent TB. For latent TB, the questions are based on the ability of the participants to describe the difference between active and latent TB in regards to its transmissibility and prevention, as well as treatment. Moreover, more than half of the focus group participants, about 59%, said that latent TB can change to active TB. For this question in particular, it is important to note that in the end, we inferred that participants responded to the latent TB knowledge question sometimes based on common sense, as the term inactive versus active were used in the questions, which are somewhat self-explanatory. So this could be guiding the response that we're seeing, with the 59% saying that latent TB can change to active TB. Also, only 26% of participants said that latent TB does not transmit to others, and the rest, about 74%, had the misperception that people with latent TB can transmit the infection to others, or they said they did not know. When asked about whether or not people with latent TB should take treatment, about 65% of participants said that people with latent TB should take treatment. And there was very limited information about free TB testing, screening, and treatment services, as only 24% of participants said that TB screening and treatment is free in BC, whereas 76% said that TB had costs, or they said they did not know. When participants were asked whether or not they consider themselves, their family members, or members of their communities to be at risk for latent TB, 37% of participants say that they did not consider themselves or their communities or their family members at risk, while the rest of the participants, about 63%, perceived themselves to be at risk for latent TB, or they responded that they did not know. Focus group participants were also asked for their feelings in cases where if they themselves, their family members, or members of the communities tested positive for latent TB, to examine individuals' feelings and perceptions, as well as communities' perceptions regarding latent TB. Focus group participants expressed a number of feelings and perceptions regarding latent TB, ranging from fear of infection, fear of transferring the infection to others, perception that TB medication is lengthy and have side effects, secrecy, shame, and hiding, to isolation and rejection by the community. Participants expressed their perception that if others found out about their latent TB status, they might get isolated. Some participants also expressed their fear by indicating that they avoid and keep their distance from people if they know that they have TB. Moreover, some participants expressed fear of impact on immigration status, as well as showed perception that TB does not exist in Canada. As said previously, there were perceptions of costs associated with TB testing and treatment, either direct or indirect costs. And there were also participants that mentioned that TB is related to low socioeconomic conditions, showed misperceptions about latent TB, as saying that they were expressed by not being able to go to school or work. Therefore, it is clear that there are widespread misconceptions, a lack of information about latent TB, as many participants reflected these feelings related to TB and latent TB. Despite health being very important to the group of participants, it is clear that it was also mentioned that the complexity of healthcare systems in Canada often results in an inability to access healthcare services. Participants identified some key challenges and barriers in regards to TB and latent TB, such as lack of information about latent TB and lack of information about TB testing and treatment services. Where participants, with exception of a few, were not able to identify correct TB clinic locations. So these two barriers, as well as language barriers, ranked as the highest challenges, followed by TB testing and treatment costs and the unavailability of TB health clinic services outside of work hours and weekends. Some identified the complexity of healthcare services, including barriers to navigate, connect, access, and utilize services, mentioning long wait times and scatter services during the discussions. Some also identified accessibility and utilization of TB information and education material as challenges. The question raised by focus group participants was how they should know to go for TB testing and treatment if they have no signs and symptoms. Therefore, it was noted that they usually seek care only when they feel sick. Therefore, seeking care behavior can also act as a barrier. So now Zarif will go through some of the quotes that came from the focus group discussions.
Thank you, Bethel. Focus groups actually established a platform, a trust platform to engage community members from ethnocultural communities to discuss their knowledge, their understanding about TB, and also feel comfortable to talk about their beliefs, perceptions, feelings, and associated stigma. So here are a few quotes that our community members, they shared with us during the focus groups. Someone with TB is suffering a lot and doesn't want others know about it because it is contagious disease and doesn't want to transfer to others. In X country, person with TB is thought is a runty, poor person, and some people avoid person with TB, which cause depression in person with TB. There was a close family member with TB who was always with kids, probably transferred the infection to us. Because there is a probability of being in contact with TB ill person, the problem with our community is there is no the habit of going to health facility for medical checkup. I should say that we translated the exact wording. So some of the quotes might not look grammatically correct, but this is how it's word by word translated. And now I ask Betel to talk about the next step.
Great. So based on the focus group written responses as well as notes from open discussions, it was inferred that overall there is a lack of knowledge regarding TB infection among focus group participants from diverse ethnocultural communities. So the TB literacy project team aimed to address this by publishing pamphlets to address each misconception and misinformation with some key important facts, including TB clinic locations and contact information. These pamphlets are available in 8 languages, Farsi, Arabic, Chinese, Tigrinya, Vietnamese, Punjabi, Swahili, and Amharic. And they will be disseminated to stakeholders as well as ethnocultural community members. And if you viewers are looking to receive a pamphlet, you can always contact MOSAIC to do so. Moreover, we will be disseminating this presentation, named the Trainer presentation, to service providers, as well. Instead of the TV Literacy Community Forum, which was scheduled for March 24th and canceled due to COVID-19, we have published and disseminated infographics and put in more resources towards pamphlet redistribution. And then there are also future plans of conducting TB literacy awareness workshops for ethno-cultural communities. And these were a couple of the infographics that were published online on March 24th, which was World TB Day. And the left is infographic highlighting some of the important facts about TB. And then the right shows the slogan that we came up with, saying this World TB Day, say no to stigma. It is time to test and treat latent TB in numerous different languages. So thank you very much for paying attention to this presentation.
Yes, thank you. And yeah.
And if you need more information or want to receive TB pamphlet, please contact MOSAIC Innovative and Health Promotion Project at 604-254-9626. Thank you.
Thanks.